Namaskar. Welcome to my YouTube channel. Today we are going to discuss about RRB Staff Nurse Previous Year Question Paper, Bilingual, Part 1. Let's start. First question. Chronic diarrhea is caused by option A. Cronibacterium diphtheria, option B. Intestinal parasites, option C. Candida albicans, option D. Mycobacterium tuberculosis. The correct option is option B. Intestinal parasites. The spinal cord is made up of option A. Neurons, option B. Cardiac muscles, option C. Smooth muscles, option D. Strained muscles. The correct option is option A. Neurons. The ligaments joint connects option A. Muscle to muscle, option B. Bone to bone, option C. Muscle to bone, option D. None of this. The correct option is option B. Bone to bone. On your way to take an examination, you suddenly get an attack of diarrhea. If you stop at a nearby drugstore for an over-the-counter opioid with anti-diarrheal action, you will be asked for option A. Codeine, option B. Dextromethorphan, option C. Diphenooxylate, option D. Loperamide. The correct option is option D. Loperamide. Penicillin was discovered by option A. Michael Faraday, option B. Sir Alexander Fleming, option C. William Harvey, option D. Charles Goodyear. The correct option is option B. Sir Alexander Fleming. Movements of the baby felt by the pregnant mother are known as option A. Lightning, option B. Engagement, option C. Quickening, option D. Ballotment. The correct option is option C. Quickening. Red blood corpuscles are formed in option A. Liver, option B. Small intestine, option C. Kidney, option D. Bone marrow. The correct option is option D. Bone marrow. Disposable syringes are sterilized by option A. Boiling, option B. Ultraviolet radiation, option C. Electromagnetic radiation, option D. Ethylene oxide. The correct option is option D. Ethylene oxide. DPT vaccination is for protection against option A. Diarrhea, pertussis, tetanus, option B. Diarrhea, polio, tetanus, option C. Diphtheria, pertussis, tetanus, option D. Diphtheria, polio, tetanus. The correct option is option C. Diphtheria, pertussis, tetanus. Transfer of genetic information from one generation to the other is accomplished by option A. DNA, option B. Messenger RNA, option C. Transfer RNA, option D. Both B and C. The correct option is option D. Both B and C. What is the nerve cell that conveys impulses from the central nervous system to the periphery? Option A. Cilia, option B. Afferent neurons, option C. Dendrite, option D. Efferent neuron. The correct option is option D. Efferent neuron. Which structure is responsible for protecting the fetus? Option A. Decidua, option B. Amniotic fluid, option C. Corpus luteum, option D. Yolk cell. The correct option is option B. Amniotic fluid. The temperature regulation center is located in the option A. Cerebellum, option B. Thalamus, option C. Cerebrum, option D. Hypothalamus. The correct option is option D. Hypothalamus. The most abundant source of iron is option A. Milk, option B. Green vegetables, option C. Eggs, option D. Beans. The correct option is option B. Green vegetables. Spondylitis is the name of a disease that affects the option A. Spinal column, Option B, brain cells. Option C, kidney. Option D, none of this. The correct option is option A, spinal column. Human body needs a constant supply of proteins to survive. The first part of digestive system to begin digesting proteins is option A, mouth. Option B, stomach. Option C, small intestine. Option D, large intestine. The correct option is option A, mouth. A patient is to be given 12 units of insulin. If 1 ml of insulin solution contains 40 units, how much insulin is to be given in ml? Option A, 0.5 ml. Option B, 0.4 ml. Option C, 0.3 ml. Option D, 0.2 ml. The correct option is option C, 0.3 ml. Persons of AB blood group are universal acceptors because option A, they can receive blood from persons of all blood groups. Option B, they have no antibodies in their blood. Option C, they lack antigens. Option D, they have a special protein in their blood plasma that inhibit clotting. The correct option is option B, they have no antibodies in their blood. Radiocarbon dating is used to estimate the ages of option A, babies. Option B, fossils. Option C, rocks. Option D, ancient buildings. The correct option is option B, fossils. BCG vaccine is given for the prevention of option A, polio. Option B, TB. Option C, diphtheria. Option D, tetanus. The correct option is option B, TB. The salivary gland secretes saliva which contains the enzyme option A, pepsin. Option B, renin. Option C, ptyalin. Option D, lipase. The correct option is option C, ptyalin. Extrapyramidal symptoms are side effects of option A, antipsychotics. Option B, antiemetics. Option C, antidepressants. Option D, anti-Parkinson agents. The correct option is option A, antipsychotics. The amount of ORS, oral rehydration solution, to be given after each stool for children less than 24 months is option A, 40 ml to 55 ml. Option B, as wanted. Option C, 10 ml to 30 ml. Option D, 50 ml to 100 ml. The correct option is option D, 50 ml to 100 ml. Retina in eyes act as a option A, lens in the camera. Option B, shutter in the camera. Option C, film in the camera. Option D, none of these. The correct option is option C, film in the camera. The possible cause of retention of urine include except option A, urethral obstruction. Option B, surgery and trauma. Option C, drug like albendazole. Option D, decreased stimulation of muscle bladder. The correct option is option C, drugs like albendazole. Which of the following is the largest digestive gland in humans? Option A, spleen. Option B, liver. Option C, pancreas. Option D, hepatopancreas. The correct option is option B, liver. The effects of aspirin do not include option A, reduction of fever. Option B, reduction of prostaglandin synthesis in inflamed tissues. Option C, impair autoregulation of kidney function. Option D, reduction of bleeding tendency. The correct option is option D, reduction of bleeding tendency. Which of the following are the four basic types of tissues that the body contains? Option A, epithelial, connective, muscle, and nervous tissue. Option B, loose, dense connective, dense regular, and dense irregular. Option C, bone, cartilage, glands, and adipose tissue. Option D, muscle, cartilage, glandular, and connective tissue. The correct option is option A, epithelial, connective, muscle, and nervous tissue. Platelet count decreases in option A, malaria, option B, filaria, option C, dengue, option D, typhoid. The correct option is option C, dengue. Source of vitamin B12 are option A, mushrooms, grains, nuts, option B, dairy products and yeast extracts, option C, bread, rice, broccoli and beans, option D, all of these. The correct option is option B, dairy products and yeast extracts. While caring for maniac patient, the nurses should keep the unit option A, active and stimulating, option B, cheerful but not too stimulating, option C, very permissive and stress-free, option D, active, interesting and exciting. The correct option is option D, active, interesting and exciting. Thank you for watching. Please like and subscribe.